Welcome to my nursing channel. So as we studied about musculoskeletal system in the last video, in that we studied the introduction, bones, function of bones, composition of bones, bone cells and classification of bone. Okay, today we will study the types of bone, anatomy of bone, anatomical terms of motion, ossification and growth, and bone healing. Okay, let us start with types. So there are four types of bones. First one is long bone. So long bone is in the shape of rods, or you can call it as shaft as well. It has rounded ends. For example, humerus, radius, ulna, femur, tibia and fibula. These are long bones. Okay, coming next to short bones, they do not have long axis. Okay, so and they are in cubical form. For example, carpals and tarsals. Okay, and next is flat bone. Flat bone protects and supports muscle attachment. They are sternum and skull bones. Okay, next coming to irregular bones. Irregular bones have various shapes. Okay, so irregular bones are having different shapes. They are not in a particular or same shape. Okay, examples of irregular bones are vertebral column, ear ossicles, facial bone and pelvic bone. Okay, this is all about the type of bones. Now next coming to anatomy of bone. So I don't know to draw and all, so I tried my best to explain in this way. Okay, so this is a long bone. This is femur. Okay, the upper part is known as articular cartilage. Okay, the end of the bone is known as articular cartilage, and this part is known as the spongy bone. So this part is known as proximal epiphysis, this part is known as metaphysis, and this shaft is known as diaphysis, and same here metaphysis and distal epiphysis. Okay, so between epiphysis and diaphysis there is the epiphyseal bone. Okay, epiphyseal bone. Later it diffuses. Later this plate diffuses and forms the bone. Okay, so this is the red bone marrow, and the outer part of bone is known as compact bone. This is the hardest bone. Okay, the inner layer is known as medullary cavity, and here are some arteries which supplies the blood to the bone. Okay, so this is the yellow bone marrow, nutritional artery. Inner part is known as endosternum. Okay, this is all about the bone anatomy. Now coming to blood supply. How the bone gets blood supply? It is through nutritional artery, peristernal artery, metaphyseal artery and epiphyseal artery. So to ribs and skull, blood supply through nutritional artery and periosteal artery. Okay, and about the nerve supply, it is through sensory and vasomotor nerves. Okay, and in lymphatics it is present in periosteum and drain into the lymph nodes. Okay, this is all about the anatomy of bone. Now coming to anatomical terms, take this as example of body. Okay, flexion and extension. So consider this as extremities. When it moves toward in front of body, it is known as flexion, and when it goes back it is known as extension. Okay, abduction means when the extremity moves away from the body or midline, it is known as abduction, and when it moves towards the body or midline, it is known as adduction. Okay, and about elevation and depression, wait for a while. So elevation and depression means movement above and below the horizon. Okay. Rotation means in a rotation there is internal rotation and external rotation. So in internal rotation, it is the rotation towards the axis of the body, it is also known as a medial rotation. Okay. And then external rotation, it is known as lateral rotation. It means rotation away from the center of the body. It is all about the rotation. Okay. After that, pronation and supination. It means rotation of forearm or foot so that in the anatomical position the palm or sole is facing anteriorly. Okay. This is all about the pronation and supination. So coming next to the ossification and growth, first we will study about ossification. Ossification means process of bone formation. Okay. Ossification means process of bone formation. So the first process is intramembranous ossification. In intramembranous ossification, here bone develops directly from membrane or connective tissue. Okay. Here cartilage does not take place. Okay. Cartilage stage is not present here. In intramembranous ossification, flat bones are formed. For example, scapula. Okay. In simple form, you can say that connective tissue turn out into bone cell formation. After that, it will turn out into bone development. Okay. Next is cartilaginous ossification. It is also known as endochondral ossification. Here, bone develops from cartilage. Okay. Here, first soft cartilage is formed, and then after it changes into bone. Here, most of the long bones are formed. For example, femur, tibia, fibula, all those bones are formed in cartilaginous ossification. Coming next to ossification plate, it is also known as epiphyseal plate or growth plate. Okay, it is present between diaphysis and epiphysis of bone. It is responsible for increase in length. Ossification plate is responsible for the increase of length in bone. Okay, the function is same. Helps bone grow longer during childhood and adulthood. Okay. And when the after growth stops, okay, when the ossification plate growth stops, here this plate closes and becomes epiphyseal line. Okay. This is all about the ossification and growth. Next, coming to growth of bones, there are two ways. First one is growth in length, and second one is growth thickness. So in growth in length, it occurs at the epiphyseal plate, which is between epiphysis and diaphysis. So process goes like, first cartilage cells multiply, after that cartilage and layers, after that old cartilage calcifies. Okay, after that bone replaces to cartilage. This is all about growth in length. After that, in growth thickness, here bone becomes thick when the new bone is added on the outer surface. Here osteoblast add new layer. Okay, after that, same as we studied the function of bone cells, it goes same. Osteoblast mineralize and form new bones, and osteoclast remove old bones from inside to maintain shape. This is all about growth of bones. After coming to let us see this factors. What are the factors affecting bone growth? So the things which help bone to grow are calcium, vitamin D, protein, exercise and sunlight. And the things which reduce growth, they are malnutrition, hormonal imbalance, lack of exercise and disease. Okay, this is all about ossification and growth. Next, coming to bone healing. Bone healing means broken bone repeats itself. When the in case of fracture and all, here bone gets repaired by itself. So there are 4 stages of bone healing. First one is hematoma formation. Here, after fracture, bone vessels break from fracture. Okay, due to fracture, blood vessels will be broken down, and blood will be clotting around the fracture. It will take place within 1 to 3 days. And the second stage is fibrocartilaginous cal- callus formation. Here soft tissue and cartilage join the broken bone. Okay, broken bone will be joined by soft tissue and cartilage. After that, soft callus is formed at the site of fracture. Soft callus is formed. It takes place within 1 to 3 weeks. Okay, and the third stage is bony callus formation. Here soft callus changes to hard bone. Here osteoblasts form new bone. It will take place around 2 to 6 weeks. After that, fourth stage is bone remodeling. Here bone becomes strong and return to normal shape. Extra bone is removed by a osteoclast. This process will be taken place within several months. Okay, and let us know what are the factors help in bone healing. They are good nutrition, calcium and vitamin D, proper sleep, immobilization. There should be no movement at the fractured part. Okay, so what are the factors that will delay bone healing are infection, smoking, poor blood supply, malnutrition, and as we seen earlier, movement of fractured bone. Okay, we will end this thing here. Thank you for watching. If you like my video, please do like, comment and subscribe. Have a good day.